Welcome to Wednesday Q&A, where you all ask the questions and we answer to the best of our abilities. I am joined by always my amazing sister from another mister, Kristen Williams.
Well, hey, everybody. So good to be here. I'm sure we have some great questions lined up, so let's get rolling.
Yes, this is from Move Well with Allison, a lit yoga teacher. I had an interesting question recently and thought it would be a good question for the podcast. My student in her late 40s was told by a holistic doctor that she should reduce exercise intensity for perimenopause. He said no hot yoga, which I agree with anyway, haha, and nothing high intensity. Have you heard of this recommendation, and what do you think of it? Well, I am not a menopausal expert, but that doesn't make sense to me completely. The only thing I could think of is that if this person was experiencing like hot flashes and a lot of like changes in thermoregulation, then getting more external heat might be exacerbating those kind of hot flashes. But the intensity, I don't know. Is this a male doctor or a female doctor? And is this somebody who really knows a lot about menopause? I think menopause is different for everyone, and this is still an area that is not, I think, well versed. In other words, I don't think there's like menopausal doctors out there. I think people learn about it, they see what happens, kind of in their patient scope. But I don't know if they've ever studied like areas of the country or areas in the world that don't have the same kind of issues with menopausal symptoms that maybe we do here in the United States or other Western countries, that I do think lifestyle is a part of. So for me, I can't imagine saying don't do something with high intensity. In fact, a lot of people would say you need to bring more high intensity in the pre, peri, and postmenopausal state in the terms of plyometrics. This is great for bone density. In terms of weight training, with added weight, your own weight, et cetera. Those are all in the high intensity scope. We know of runners who continue to run in those areas, and some could argue that there's high intensity of that. So it doesn't make sense to me with the full, disclaimer that I am not a menopausal expert, but I certainly have done a lot of research of my own. I certainly have read up and talked to my functional medicine doctor, who I think would disagree with that, unless there was something that was, again, really off with thermoregulation, where that change of, because when you start exercising in high intensity, your heart is beating faster, your vessel, everything's going to open up more, so there's more blood flow, more heat. And if your body isn't regulating that well because of some hormonal or endocrine, misfiring or something, then that would be reason to not do it. Do you have any thoughts on that?
That was my thought too. Again, and full disclaimer, I'm not a doctor. I mean, I'm a doctor of physical therapy, but I'm not a medical doctor. I don't specialize in menopause, but I would say, just as we do in physical therapy, there are contraindications to exercise. And so if this person is, has an MS or something where she already has an autoimmune reason for having thermoregulation issues, then I could see that. So I don't think we have enough information, and I would argue perhaps this doctor wasn't making a blanket statement either. He might have been making the statement for her. Laura, you said it. Everyone is different with their menopause. Some people, they barely feel a thing. Other people, it's horrible. And people differ in thermoregulation. Lord have mercy, we see it in the studio, where you have some people who they're pouring with sweat by the end of the reset. Other people aren't. It doesn't matter how hard you push them, they don't sweat. So that is just a body difference. So I would probably guess that guy wasn't making a blanket statement. He might have been making it for her specifically. I agree with you. I hesitate to ever tell someone not now. Hot yoga, we all would agree. I mean, any artificial heat is going to substantially ratchet up anyone's issues, whether they're having perimenopause or not, with thermoregulation. And I also think a lot of sense, really decreases your sense of where your body is in space. Therefore, it's a little less safe, blah, blah, blah. I'll get off that. But, so I would question, does she have other things that would make it either contraindicated or an absolute contraindication to it? If not, I'm in your boat. I would really, I think this is more symptomatic. If the hot flashes are bad, then, I don't know. Can you improve hot flashes with exercise? I don't know. I don't know enough about it.
Yeah, I don't either. I definitely have had people who've said that, well, they don't get hot flashes when they're exercising. It's usually some other time, but they improve when, again, they're in better shape. I'm not saying people that have hot flashes are not in good shape. I'm just saying that it all depends. Like we were talking about again. I mean, some people have periods that just, they don't even know it's coming. It comes and it's no big deal. And others are like, down for the count for 2 days. So everybody is different, and we do have to really acknowledge that. So I would say learn some more about maybe why this doctor said that, because there might have been a reason and maybe there was not. Who knows? Okay, Jaja Yoga. Where to start with someone chronically not able to move his neck? Triple S on the floor is impossible.
Yeah.
You want to start with that? Yeah.
Yeah. Well, and so again, chronically unable to move the neck. Honestly, we're seeing this more and more. I was talking with my private client this morning, and we were talking about something unrelated, but relating it to the neck. And he said to me, and he works in New York in finance, and he said, honestly, Kristen, I think most people, if you would ask them, in our Western current society, have neck pain. And I was like, you're absolutely right, because of what we're putting our bodies through. So my question would be, is there a true restriction, which we do see? And as people get older, I would see this a lot with my older clientele who have worked or commuted or done something at a computer. Our engineers, our people who are at a desk, our coders, they literally, have started, you can see, but on an x-ray, there is bony change because arthritis in your neck starts a lot earlier than in most areas of your body. For this, it's posture, people. You look at I cried when my children, they would sit with this beautiful, perfect posture. And then right around, preschool to early elementary, they start doing this. And I don't know, is it learned? Is it because now our head isn't as big in relation to our body, so it's not as hard to hold up? When you're little, you've got this giant head. So the body is going to put it in its most supported position, which is in perfect triple S posture. As our body grows, our head doesn't grow at that same rate. So I think we just start to get lazy, and then we're put in chairs all day at school. We lose that posture. There's less play. So number one, not all loss of range of motion is true loss. We can restore a lot, but we have to change habits. So, and it requires someone to not just come to the lit yoga mat and go into a triple S or lie on the ground and find a triple S for an hour a day. It is changing what you're doing throughout the day. It is purposely turning your head to look over your shoulder, not turning your whole body. It is purposely drawing the occiput up, the mastoid process up, and actively getting into that deep cervical flexion to lengthen the spine. It's correcting the pelvis. So I would be curious, and he might be someone, they're in their 40s. So that, I don't believe, in my experience, I have seen not many people in their 40s where it is true, like stenotic change, where we can't restore range. And so these are the people that, you talk to them about what they're doing off the mat, how can they make changes in their life, and then you give them some neck exercises to do. You ask them to do the work. some people just don't have time. They don't have the inclination. They're not going to do it. And you can't put that on you, that if someone's not going to do the work, it's not your issue to fix them. We see this a lot in physical therapy. You feel like, my God, I can't get them better. Well, it's 10% what you do on the mat. It's 90% what you do off the mat. Same thing is true in a yoga class. So give them the tools to try to help themselves. Maybe they go see a physical therapist who can help with some manual stuff. But at 40, I would argue it is not yet, most likely, unless there is an ankylosing spondylitis or something that is, again, more an autoimmune issue. It is most likely soft tissue restriction and habits that we need to change. And then we can get to, we may never get to a beautiful triple S that's this ideal. But again, back to last week's episode, let go of perfect and let's just try to improve. What else do you have to say on that, Laura?
Yeah, I mean, I totally agree. And I would say that getting triple S on the floor doesn't mean that everything's on the floor. Like, put a block under the skull. Start to get, because, like Kristen just went through all the anatomy of it. But if your atlas, your first cervical vertebra, is not on top of the other ones, it's really hard to move your head. Because again, there's so many reasons, right? It's soft tissue, and then there's the joints are not stacked in a way. So getting the triple S doesn't mean that so people that are, I think everybody listening probably knows what triple S is, but it's the skull, the scapula, and the sacrum. And in the beginning of class, we often lie on our back and we kind of feel that. And that is a way for people who are living in a kind of zoomed out way in their daily life to actually start to understand and neurologically encode this feeling of a more neutral position. And if a person's there and their chin's way up or they can't even get their head on the ground, you just put something underneath it. That actually is a wonderful stretch for the back of the neck, because when somebody is unable to really move their neck well, it's a combination of they have extra flexion in the very bottom of the cervical spine and extra extension at the top. So you have to kind of get the upper cervical more flexed, meaning like to be able to slide the skull back, and get a little more extension in that lower cervical T-spine area. So like Kristen said, this is something a person needs to work on kind of relentlessly, but it doesn't mean you're going to do it 24/7. It's just as many times as you can think about it. We do shoulder rolls. Well, why are we doing that? We're going the opposite direction we tend to go. We're trying to free up some of the tissue that gets restricted and is getting tighter when the head is protruded. So it's not impossible until you are fused or something else. So just keep at it. But like Kristen said, an improvement might still not look great, but it's an improvement. So it's like you just want the person to feel like they've got more space in the back of their neck and less strain in the front.
We've got some nice videos on.
I was going to say, your stretch class, everybody should take that to help really assess, like, where are you right now? But then we have a lot of neck stuff.
Neck mobility. So our teacher, Shafali, she says for the last several months, I have this 15-minute neck mobility class. She goes, I do it every night before I go to bed. And it's been a game changer, because what is she doing? She's just mobilizing. She's moving, because she is in corporate world. She's on the computer all day long. She's, in Zoom. And so she has learned that by just doing those moves, it's nothing crazy. It's 15 minutes out of her life. She feels better, because movement is medicine.
It is. And it's never too late to improve your neck, people. And it's not just improving your neck. It's improving your blood flow, your energy, down the chain, your movement, all of these things. There's so much related to when your neck is not in its best alignment. All right. This person wrote just Elman, L-M-A-N. It's kind of like Laura Hyman, but that's a limit. Maybe anyway, it's all one word. My feet hurt first thing in the morning. Any advice? Help. Well, Okay, so just like anything else, like when we answer these questions, this is all we're given. We would, as physical therapists, actually go deeper. Like, what do you mean? Where does it hurt? What part of your foot hurts? Does it feel like you're stepping on hot coals? Does it feel just really tight and compressed? Like, what's the feeling of hurt? And then, of course, we would look at all the other things, movement, and talk about like what you're putting your feet in all day, what your daily life is like. Are you sitting a lot of the time? Are you running? There's all kinds of things. Most people who I think I've seen that say when their feet hurt first thing in the morning, it's going to be something around the plantar fascia, Achilles heel combo, So it could be that and it makes sense. Like when you're moving, your tissues get warmer, there gets some blood flow, and then you're still, and they kind of get like root. And then the first thing you do is step on that kind of restricted fascia, and it will be very painful. So anybody with plantar fasciitis understands that's like the cardinal sign. My feet hurt when I get out of bed. It's like I can barely put weight on them. So that would be my first instinct, unless it was something like the way you're sleeping and you're curling your feet, plantar flexed, or like they're stuck in, sometimes I can't remember who it was. We were, I think it was Brenda Lawyer. So he was saying like, make sure you don't do the hospital type of corners, because when you do that, you kind of slide your legs in and then they get stuck in a more plantar flex position. Because the hospital corners are so severe. So better to have like a little bit of a lighter hold, messier bed. So your feet are also not stuck or bound into one position overnight without you even realizing it. And there's a lot to be said if it is plantar fasciitis. You have to work on so many things. This could be an entire episode, but you do want to try and calm down the inflammation, and people will tell you that you should wear inserts. I would only wear them for a little bit of time. You don't want to, and then there's other people that are like, don't wear inserts, get barefoot and just like manage some of that pain to help get that fascia freer. You can roll a little bit on it just to get some heat into the plantar fascia, but you ultimately need to figure out why that's happening. And that's probably decreased mobility of your ankle and your hip, maybe being in a shoe all day, maybe running in a repetitive way. There's lots of factors. That's why we would need to ask a lot more than that. But anytime you wake up and you're in pain, just think, I don't deserve this, and this is not necessarily normal, so what to do about it? And so I would definitely, Elman, go see somebody, a physical therapist. KB and I do privates virtually, but seeing a person in person is great. If you can do that, just go and get it checked out, because it's not something you want to just live with.
Yeah. And I think, kind of piggybacking on the last question, you said this, mobility. Some of the things that I'll give people to do, even before they take their first step. Yes, stretching out the calf. Yes, stretching out the ankle. But, thinking about just that soft tissue, that dura. That dura is like what lines the spinal cord and not the nerves. And, from the crown of the head all the way down to the tippy toes, sometimes that can just be tight, that posterior line. So I've had people, I'll kind of sit on my little bed here that is in my room, that I'll have them like, all right, before you even get out of bed, just, get out, sit, drape your legs off and do a little bit of like a nerve glide where you're going to.
So KB's sitting on the bed, straightening her right leg, like kicking it straight, and then lowering her chin. So it's getting that and then lifting and lowering it. Yeah.
And so I just have them do that 5 times. And I have them stand up, turn around, and do the stretch, the gastrocnemius, soleus. Just so you're loosening it up, and that becomes your daily practice. It takes you 90 seconds, so it's not a big chunk out of your time. That's one thing. My dad still does it. I've told this before. My dad, this 6 years ago, he had plantar fasciitis. He does it every single day. He doesn't have any pain, but he does it. It's preventative. So again, movement is medicine. But to your point, Laura, getting someone to look to see the root cause, what can we affect further up the chain that might be causing you in your gait pattern, in your running, in your shoe wear. What can you change? Because like you said, I love that you said, if you're waking up in pain, that's not acceptable. We can do stuff about that. We can eradicate that. And it's gonna be taking a deeper dive than just zeroing in on the foot and ankle, which I'm sure needs work. But I would argue stuff further up the chain might need some attention too. And you'd be surprised. Yes, you can do the palliative stuff. I love that you mentioned the rolling always helps. We're just loosening the plantar fascia can get kind of bound down. And I love the hospital corners, having the feet pointed all night. That's going to shorten things up. I mean, oh my gosh, the Strasbourg sock, that was so big when we were getting out of PT school. They would put poor people in this contraption that would keep your foot dorsiflexed all night long.
And then talk about not being able to have sheets on top. It's like so weird. Yeah.
It's so weird, as opposed because they wanted to keep it on stretch. Come on, people. Like, nobody's sleeping well with that. People get put in boots, the stuff they do for people. It's like, that is so short-sighted and like microscopic rather than looking at the full body. So yeah, go see somebody, Elman, and and really have someone look at you. If you go to somebody and they're just looking at your foot, I would try to find somebody else, who will look at you up the chain and really
ask you, do you have TMJ? Do you grind at night? Because all that is this all is linked, even though it seems like very far away. Most people will feel it in their jaw, but you could feel it in your neck. You could feel it in your feet. You just don't know. So yeah, you want to go to somebody who's asking all kinds of questions like that. What you're doing during the day, what you're doing at night, etc. So good luck with that. Nobody deserves to wake up and feel pain much in any way. Okay, so this is a good one. This is one that I screenshotted and the name is off. What is your favorite self-care tip? I thought we could end on that because that'd probably be fun. Self-care tip.
I know. It's so funny. I'm the worst. Like, I'm the worst when it comes to self-care. I admit. People will buy me gift certificates for like massages or facials, and it takes me a year to use it because I don't ever think in those terms. That being said, I would say for me, my self-care comes in the way of exercise. Like I do prioritize that in my life. It makes me feel good. It is something that I enjoy. So I am one of those weird people that I've always liked exercising. I've always liked doing it alone. I don't need the social. I'm thankful for that because I know a lot of people, they hate it. It's not what they enjoy. So I think that is my self-care. But also, and I've said this before, reading, just taking a moment or 20 minutes to let go of whatever is going on and just dive into a good book. And I'm talking about, like, it can be anything from fantasy fiction to a biography, but just something that takes me away, because I'm like anybody else. I can get into my brain, and that's where I can get stressed. And so my self-care comes in terms of exercise and escape from just anything but an imaginary good story that's about human life. I love human interest stuff. I'm not even a person that sits and watches a show. I just love to read. So for me, it's reading and exercise. What about you, Laura?
Yeah, I love that. I think self-care, I think it's such an interesting concept in the sense that we should be self-caring every day. And so, yeah, I'm like you. I think everybody's different. Like I was the same way. Movement always settled I just am a nicer person. I'm just better in myself and with others. And it's not a punishment, So self-care to me feels like sometimes people think of it as like something they need to do because they deserve it or whatever. You do deserve it, but you deserve it every day. So don't reserve it to like, so that's why I think movement, and again, movement shouldn't be like something you do to burn calories or to fit in a pair of jeans or whatever. It should be because our bodies are made to move. Our brain was created because we move. That's the reason we have this incredible, and all the things that accompany that. So Yeah, for me, movement is self-care. And when I don't move, I don't feel as good. And that doesn't mean I don't add on little things like you said, a massage and things like that. That feels amazing. Those are wonderful. But self-care to me is movement and reading. I also read. I love, it's kind of like winding down. And just trying to be the best version of myself, I think, is the best self-care, because then we feel clear and clean and consistent. And it doesn't mean every day is the same, but that's self-care. That's like taking care of all the parts. Yeah.
And I think part of that is, like you said, being the best version of yourself. Pointing out that it is every day, and be okay with that. Like, it is okay to take however long you need and pay attention to yourself. Give yourself what you, I think we are just, everything is work hard, play hard, work hard, play hard. Well, what about relax hard,
Yes. Oh, yes. And rest. Rest. I am a big believer in rest. I think people think that the two of us are busy, which we are, but we are really good resters too. Like, whenever I need to rest, I have and that doesn't mean I'm taking a nap, but it's just, I'm on the couch, I'm reading a book. Like, it's important. And rest is part of that self-care as well. And I think, again, when you are in tuned and listening, and it isn't ever from we have to stop judging ourselves. When people talk about movement or exercise, that's why I think movement is a better term, because it's whatever. It could be 10-minute walk down the street. It could be, stretch. It could be run. It could be practice on the mat. Whatever form of movement is making you feel more alive, not to be able to do something else, right? It's just in this moment, so that each day you're in that more alive state, because I think, that there's a lot of distractions and stuff that happens. And and when you're more tuned in, you're more tuned into when you need to rest. And that might be like a small or big portion of the day, or not every single day, but it's tuning in. Yeah. All right. We'd love to hear from you. What do you think is self-care? And any other questions, you can write us at support@lityoga.com. You can ask us anything, as you can see.
Yep. Or you can find us on Instagram. Laura is at lara.hyman, and I'm KBWilliams99. Just drop us a DM. We will screenshot it. We'll try to remember to get your name. And I do that all the time, Laura. I'm like, dang it.
I know. Sorry about that, self-care person.
Yeah, and we will get to your questions. And, and I know that every question you ask, there's somebody else out there that has the same question. And so that's the joy of it too. I think when we hear other questions that pertain to us, it's like, again, no one is perfect. And everybody is seeking answers and seeking, just to feel better. So let's feel better together.
That's what we're about. All right. We want to feel lit up. And as always, we're pulling for you.